Have you ever heard the term going into shock and wondered what it really means? It's not just about being surprised or scared. Medically, shock is a life-threatening condition where your body isn't getting enough blood flow. This means your cells and organs aren't receiving the oxygen and nutrients they need to function properly. Today, we are diving deep into the different types of medical shock, what causes them, and what can be done. First up is hypovolemic shock. Hypo means low, and volemic refers to volume. So, this is shock caused by a low volume of blood or fluids in your body. This can happen from severe bleeding, major burns, or even extreme dehydration from vomiting or diarrhea. The heart doesn't have enough blood to pump, so blood pressure plummets. Next, we have cardiogenic shock. Cardio means heart, and genic means originating from. This type happens when the heart itself is damaged and can't pump effectively, even if there's enough blood. The most common cause is a severe heart attack, but it can also result from heart failure or inflammation of the heart muscle. Then there's anaphylactic shock, which is a severe, whole-body allergic reaction. When you're exposed to an allergen you're extremely sensitive to, like a bee sting, certain foods, or medications, your immune system goes into overdrive. It releases a flood of chemicals that cause your blood vessels to widen dramatically and your airways to narrow, making it hard to breathe and causing a rapid drop in blood pressure. Septic shock is another serious one. It's a complication of sepsis, which is the body's overwhelming and life-threatening response to an infection. The infection triggers a chain reaction throughout your body, leading to dangerously low blood pressure and organ damage. Any type of infection, bacterial, viral, or fungal, can lead to sepsis if not controlled. Finally, there's neurogenic shock. Neuro relates to the nervous system. This type is caused by damage to the spinal cord or central nervous system. This damage disrupts the signals from the brain to the blood vessels, causing them to relax and widen uncontrollably. This sudden increase in vessel size leads to a sharp drop in blood pressure because the normal amount of blood is no longer enough to fill them. So, how do doctors diagnose shock? It's usually based on physical signs and symptoms. A person in shock might have a rapid, weak pulse, low blood pressure, rapid, shallow breathing, cold and clammy skin, and confusion or unconsciousness. Doctors will run tests like blood work, imaging scans, and an electrocardiogram to pinpoint the underlying cause and the specific type of shock. Treatment for shock is an emergency and must happen fast. The primary goal is to restore blood flow to the organs. For hypovolemic shock, this means giving intravenous fluids and blood transfusions to replace lost volume. For cardiogenic shock, treatment focuses on improving the heart's function with medications or procedures to open blocked arteries. Anaphylactic shock requires an immediate injection of epinephrine, often from an auto-injector pen, to counteract the allergic reaction. Septic shock is treated with antibiotics to fight the infection and fluids to raise blood pressure. For neurogenic shock, the focus is on stabilizing the spine and using medications to support blood pressure. While you can't prevent all causes of shock, you can take steps to reduce your risk. Manage chronic conditions like heart disease and diabetes, get vaccinated to prevent infections, and be cautious to avoid injuries that could cause severe bleeding or spinal damage. If you have a known severe allergy, always carry your epinephrine auto-injector and know how to use it. Recognizing the signs of shock and calling for emergency medical help immediately is crucial. It can truly be the difference between life and death. If you see someone with these symptoms, call your local emergency number right away. Don't try to give them anything to eat or drink. If they are not injured, you can lay them down and elevate their legs slightly to help blood flow to their vital organs. We hope this video helped you understand this critical medical condition. Knowledge is power, and being prepared can save a life. If you found this information valuable, please hit that like button and subscribe to Medics Learning for more essential health content. Thanks for watching, and stay safe.